pet parents. In this video, we're going to be talking about canine soft tissue sarcoma. Hi, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home. One way in which we do this is by producing this channel. So if you give us a like and hit the subscribe button, you'll be paying it forward to one of the millions of Americans who do not have easy access to veterinary oncology. I hope that this channel brings them the information that they need to make informed decisions for their family members. Okay, so what exactly is soft tissue sarcoma? Well, it is a type of cancer. So let's talk about what cancer is and then specifically soft tissue sarcoma. All cancers are a proliferation or overgrowth of a particular cell type. Sometimes it's a group of cells, but it's a group of cell types. For example, liver cancer comes from liver cells, and brain cancer comes from an overgrowth of brain cells. So all cancers are an overgrowth of a particular cell or group of cells. Soft tissue sarcoma is an overgrowth of connective tissue cells. This particular cancer usually arises either on top of the skin or just underneath of the skin, where you find a lot of connective tissue. They can arise anywhere on the body, from the face to the trunk to the paws. They can start out as little firm marbles under the skin, and sometimes, seemingly in a very short period of time, there's a very large mass somewhere on the pet's body. They don't always have to be hard. Sometimes they have soft and squishy spots and a hard part in the middle. Sometimes they're very movable. You can kind of put your hand around it and move it under the skin. And sometimes they're attached under the skin. They're stuck there, and no matter how much you try, you can't really move them around. The reason for that is most soft tissue sarcomas have microscopic tendrils or tentacles that kind of radiate out from the marble or the mass that you can see and kind of get your hands around. And it's those little tendrils that A, stick to the underlying parts of the body, and B, also make them a little bit challenging to deal with. So how do we treat soft tissue sarcoma? Well, the first line of defense, when possible, is surgery. Surgery is by far the number one way to deal with a soft tissue sarcoma, because if it can be removed with clean margins, we are almost always going to cure that patient. There are always caveats in cancer, and a lot of times we're dealing in probabilities. But for the most part, if I have a dog with a soft tissue sarcoma and a surgeon can remove all those little fingers or tentacles, 80% of the time that dog is going to be cured of that cancer. But sometimes a clean excision just isn't possible, or after surgery we find out more about the tumor that makes us a little bit more concerned about it. For example, I mentioned clean margins. Well, clean margins means that the surgeon got every single cancer cell. If any cancer cells were left behind, especially when it comes to soft tissue sarcomas on the trunk of the body, they are very likely to return. Soft tissue sarcomas located on the lower limbs, whether it's a front limb or a back limb, tend to have a more quiet behavior, so that even if we don't get every single cell out, they don't always come back. The other thing we learn about soft tissue sarcomas after they're removed is its grade. So the grade is based on microscopic characteristic of that tumor that the pathologist can see under the microscope. And the grading scheme for soft tissue sarcomas ranges from 1 to 3. So you either have a 1, 2, or a 3. Grade 1 and 2 tumors are very unlikely to spread to other locations in the body. So there are some cancers that even after you remove them, 3 months later, we know that there's a high probability of it showing up in the lungs or a lymph node or the liver. But for grade 1 and 2 soft tissue sarcomas, that is very unlikely to happen. Grade 3 soft tissue sarcomas have about a 50% chance of showing up somewhere else, usually the lungs, even after they're removed. So I hope you're starting to appreciate that there is quite a degree of variability within just this one tumor type. Is the soft tissue sarcoma located on a lower leg, or is it on the trunk? Was it removed with clean margins or dirty margins. Is it a grade 1 soft tissue sarcoma or a grade 3 soft tissue sarcoma? Did the soft tissue sarcoma develop on a dog who hates getting in the car and thinks that is the absolute worst thing you can do to it? Did the soft tissue sarcoma arise on a pet who absolutely refuses to take any pills? These are all things that we think about when trying to decide how to help a pet with a soft tissue sarcoma after surgery. So again, if your pet has been diagnosed with a suspected soft tissue sarcoma and it can be removed, it should be removed. But is post-surgical therapy warranted and or possible for this pet? For example, if I'm dealing with a grade 2 soft tissue sarcoma that's been removed with narrow margins from the lower back leg, and especially if the dog is maybe 15, I'm not going to feel very strongly about following up with radiation therapy or chemotherapy or targeted therapy, because it's not likely that the tumor is going to come back in a short period of time and affect that dog's quality of life. However, if I have a grade 2 soft tissue sarcoma that's been removed with dirty margins from, say, the trunk or the chest wall of a dog, well, that tumor is very likely to return, and it could do it in a short period of time. So I would talk to the family about follow-up therapy or adjuvant therapy. Adjuvant means in addition to surgery. So for a soft tissue sarcoma, that could be radiation therapy. Medically speaking, radiation therapy is excellent at destroying those microscopic tendrils that may have been left behind. But like all therapies, radiation certainly has its pros and cons. So the big benefit is very likely to be effective. The downsides to radiation therapy, or maybe not the downsides, but the challenges, the obstacles to radiation therapy are it's not offered in many places. It's even harder to find radiation therapy than medical oncology or a surgeon. It requires a special machine that is put in a very sort of special room. It has lead lining and requires staff with particular skills. So for a lot of people, they have to travel at least 2 hours, sometimes up to 4 hours. Around here, that could be even up to 6 hours to access a radiation oncologist. So that's just not an option for most families. The other challenge with radiation therapy is that in order for it to be safe and effective, it has to be delivered in multiple small doses over time. For a soft tissue sarcoma, that could be anywhere from 16 to 20 treatments given over the course of about 3 to 4 weeks. And the pet is under anesthesia for each one. Most families can't really accommodate that unless they bring the pet to the hospital, drop them off for that period of time, and then go pick them up afterwards. So if your dog has been diagnosed with an incompletely excised soft tissue sarcoma somewhere other than the lower limbs and radiation therapy isn't an option for you, what else can we do? Well, one option is something referred to as metronomic chemotherapy. Now, I know I just said the word chemotherapy and most people will tune out by this point. Please don't. Chemotherapy in pets is quite different than it is in people. We really are trying to maintain an excellent quality of life while the pet is going through treatment. So the doses that we use and the schedules that we use for all of our chemotherapy protocols is different than what they do in people. Metronomic chemotherapy is, well, even more different. We are giving very low doses of oral chemotherapy every other day, sometimes every day, which is usually very well tolerated by the pet. Now, I would say maybe 10% of dogs don't tolerate even this low dose of chemotherapy. And in that case, I'll try an even lower dose, or if I'm giving it every day, maybe I'll try every other day. Maybe I'll instruct the family to give an anti-nausea medication about an hour before and then give the chemotherapy. Sometimes we'll just change out one drug for another, or if the pet really can't handle it, then we'll stop. Again, veterinary oncology is very different than human oncology. We really are trying to maintain an excellent quality of life while the pet goes through treatment. Now, if I prescribe metronomic chemotherapy, I'm usually doing that for somewhere between minimum 6 months, maximum up to 12 months. I usually stop at about 6 months. Many other oncologists will prescribe for at least a year, And there are some oncologists that will prescribe this for life. The goal of metronomic chemotherapy is to inhibit the tumor cell's ability to attract blood vessels, which will then feed those cells and allow those cells to divide and grow and turn into another tumor. Now, if I have a dog that had a soft tissue sarcoma that was completely excised, we know that all the cells, or we know to the best of our ability that all the cells were removed by the surgeon, but it turned out to be a grade 3 soft tissue sarcoma. I'm going to be a little bit more worried about that pet. There's about a 50% chance that that tumor will still show up somewhere else in the body. It will spread, it will metastasize, usually to the lungs. That's the most common place that we will find a metastatic soft tissue sarcoma. So if I have a pet with a grade 3 soft tissue sarcoma, I'm usually going to recommend maybe metronomic chemotherapy, but I will add other options. Traditional IV chemotherapy is an option. Again, different doses and different schedules than they use in people, usually excellent quality of life while they're going through treatment. And if they have any trouble, we're going to change the plan. Another category of therapy that we can use against soft tissue sarcoma is referred to as targeted therapy. Now, targeted therapy is a little different than chemotherapy. They both treat cancer, but in different ways. Maybe kind of the way Tylenol and Advil treat a headache, but by different mechanisms. And that's why Tylenol works for some people and Advil works for other people. Chemotherapy goes into the body and kills rapidly dividing cells indiscriminately, whereas targeted therapy, well, it targets specific mutations in the cancer. And we can analyze tumors now to find out which mutations are present. And sometimes that information is really helpful. It kind of narrows down the list of potentially effective cancer drugs, whether they're traditional chemotherapy or targeted therapies. And targeted therapies are usually oral pills that parents can give at home. And again, just like with metronomic chemotherapy, if I'm treating a pet with targeted therapy, for a minimum of 6 months, I'm really worried about this tumor. I will probably treat for up to a year if the pet is tolerating it and if the family can afford it. Now, those are all of the direct cancer treatment options: surgery, radiation therapy, chemotherapy, targeted therapy. These are all treatment options that are narrowly focused on the tumor itself. But what about the whole pet? So in veterinary oncology, especially in my practice, we like to look at the pet as a whole, not just as a tumor. So what can we do to support that pet while they're going through treatment? Or even if it was a low-grade soft tissue sarcoma and we're not following up with additional therapy, there's still a little chance that tumor is going to come back. Is there anything we can do to strengthen that pet's immune system or optimize the pet's immune system to maybe reduce that risk a little bit? And the answer is yes and maybe. There are a lot of things that have been shown in human medicine and in animal models that can decrease inflammation, optimize immune function, but will those strategies always help every pet with cancer? The answer is no. Just like the therapies that we have, some work for others, some don't work at all. That I go back to the Tylenol and Advil example. When I have a headache and I take Tylenol, it doesn't work. That doesn't mean that Tylenol is a scam and should be taken off the market. And, we should only be using Advil. The same is true for supplements and dietary changes. They definitely seem to help some pets and people, and maybe that strategy doesn't work for others, and they can eat burgers and Doritos and smoke 10 packs of cigarettes and they live to be 110. And you have another person who's doing all the right things and they unfortunately get a terrible disease at the age of 35. That doesn't mean that everyone should smoke 10 packs a day and eat Doritos all day. Okay, so some little strategies that you can do to maybe help your dog's immune system. Well, the first is adding some whole fruits and vegetables. Whole fruits and vegetables have been shown over and over and over again to reduce our risk of developing cancer. And this has been shown in 2 little studies in dogs as well, just looking at a particular tumor type, not all tumor types. But my point is that a diet rich in whole fruits and vegetables has been shown to reduce our risk of developing cancer. And in some human studies, it was also shown to improve survival times in patients who already had cancer. So what am I talking about? Well, in one interesting study, they took two groups of women, both had the same type of breast cancer, and both groups got the same cancer therapy. They asked one group to add 3 servings of vegetables a week to their diet, and that group of women lived 40% longer than the group who did not add the vegetables to their diet. So does one study automatically mean that we can apply this across the board and it will work 100% of the time? Of course not. But vegetables are not going to hurt your dog. So if you can add some vegetables to their food, there's a lot of benefits to that. Vegetables are rich in antioxidants, which can decrease chronic inflammation. Some vegetables, like cruciferous vegetables, are rich in a compound called sulforaphane, which is a potent cancer fighter. And then the final thing that I love about vegetables is that they are a rich source of fiber. Why do we care about fiber? Fiber feeds the beneficial bacteria in your gut. Your gut houses 20% of your immune system. So you want to make sure that those bacteria are very happy. And then I always get asked about supplements, and it's understandable why. There is a lot of research and, of course, a lot of claims on the internet about supplements. There are a few that I like that I think might be helpful. A CBD supplement is one of them. I have a whole video on CBD supplements for dogs and cats. A mushroom supplement, I like a multi-species mushroom supplement. Mushrooms have been shown to decrease inflammation in a lot of ways, but one of the reasons that I love mushrooms so much is that they've been shown to promote the activity of a particular cell of the immune system called the natural killer cell. The natural killer cell naturally kills cancer, so it is my favorite cell, and anything I can do to help that cell out, I'm going to do. So sometimes a mushroom supplement can be helpful for patients with any type of cancer. Now, if you Google supplements for dogs with cancer, I'm sure you will find probably 100, maybe even 1,000 options that you can consider. It can be very overwhelming to try to decide on your own how to move forward with that. I would say the number one question I get asked when I'm talking to pet parents is, what should I feed my dog and what supplements can I give them to, naturally help keep this cancer from affecting them? The second most common question that I get asked is, how long is he going to live? Sometimes that's a difficult question to answer. Sometimes I'm much better at predicting what's going to happen if we do nothing versus if we do something, and certainly versus if we do everything. But when it comes to soft tissue sarcoma, if we have a low-grade soft tissue sarcoma that's been completely excised, we've probably cured that patient. Not always. Sometimes soft tissue sarcomas still return because they're ornery little buggers. But for the most part, if we can completely excise a low-grade soft tissue sarcoma, by low grade, I mean grade 1 or 2, if we can completely excise those, chances are it's not going to come back and it's not going to spread. Now, if I have a low-grade soft tissue sarcoma that has been incompletely excised or narrowly excised from a lower extremity, even then, sometimes the tumor doesn't return. For some reason, soft tissue sarcomas in the lower extremities have a different behavior than soft tissue sarcomas found in other areas of the body. If I've got a high-grade soft tissue sarcoma that's been completely excised, there's still around a 50% chance that we're done with it, that it's not going to show up somewhere else. And this is a situation where it's very difficult for me to predict prognosis, because I don't know for sure that that tumor is going to come back. I don't know for sure that treating a pet with adjuvant therapy is going to prevent that tumor from coming back. I don't know if that tumor is going to come back in 2 months or 16 months. And it's important to understand that individual patients are not statistics. Statistics kind of help us predict what's going to happen in a population of patients, but they don't predict what's going to happen in one patient. So statistically speaking, a dog with a high-grade soft tissue sarcoma is going to develop metastasis probably within a year. That doesn't mean that your pet is going to develop metastasis within a year. If a pet does develop metastasis within a year and all the treatments we try don't help, that pet is probably going to be feeling pretty sick within about 3 to 6 months of first seeing the tumors in the lungs. But if we try some treatments and they work, I don't know if they're going to work for a month, 6 months, 12 months, or 24 months. So again, it's almost impossible for me to predict what's going to happen if we try therapy and it's successful versus I've got a bad situation on my hands and for whatever reason, we're not going to treat or we just can't treat. That all being said, I will be blunt and say that cancer definitely sucks, and if it shows up in the lungs, it is usually very difficult to get under control for a significant period of time. And by significant, I mean a year or more. It's not out of the realm of possibility that we can help that pet for several months, but it's unlikely that we're going to cure that pet if the cancer has spread. Now, I hope one thing you got out of this video is that every pet is different and every pet with cancer is different. Even if there are 5 dogs in a room and they all have a soft tissue sarcoma, they can all be a little bit different. Those tumors will have a different genetic profile. They will have a different grade. One will be amenable to surgery and one won't. So if you do live near a veterinary oncologist, I encourage you to make an appointment for a consultation. That consultation does not commit you to any one treatment or another, but I do think that you will find that information very valuable and it will help you make a decision for your family member. Now, if you're one of the millions of Americans who do not have easy access to veterinary oncology, you can reach out to me. I do offer consultations direct with pet parents, though I cannot make a diagnosis or prescribe any medications. I can talk to you about what your veterinarian has already done, what those test results mean for your pet, and what options you might have available to you. The other thing I offer is consultations direct with general practitioners. So you could ask your general practitioner to reach out to me and I will provide a cancer care plan specifically for your pet, for your general practitioner to implement wherever you live, whether that's Yakutat, Alaska, or Jackson, Mississippi, it doesn't matter. And there are other virtual oncologists out there as well. There are a group of us that are really trying to help pets with cancer who do not have easy access to veterinary oncology. Now, if you found this information useful, please give us a like and hit the subscribe button. It does help us continue this channel and provide information to pet parents all over the world. Again, my name is Dr. Vanessa Rizzo. I'm with Hope Veterinary Oncology Services, and we bring veterinary cancer care closer to home.